Hi, I'm Dr. Thomas Su of Artlipo Plastic Surgery, and today I'm going to talk about doing the thigh liposuction in a way that's very different from what other doctors do. Here at Artlipo, we do liposuction, that's our specialty, and we do things very much more completely in terms of coverage of the area that's done, also in the completeness of what is done. Today specifically we're talking about doing a lipo 360 of the thigh, including the knee. And this is something that I would say very few doctors out there do. I'm going to show you in a little bit about what other doctors do. I'm going to show you visually on this photo here what's included in the typical liposuction that other doctors do. And then I'm going to show you what's different about what we do here at Artlipo. So like I said, liposuction is our specialty, but here at Artlipo, I'm even more specialized compared to the other doctors. We have two other plastic surgeons that do a lot of other body areas, but here at Artlipo, I'm the thigh and leg specialist. What makes me a specialist? Well, because I treat so many cases of involved liposuction. If you know anything about lipedema, lipedema is a fat disease that affects the entire leg, but more so in the lower leg, ankle, calf, and knee regions. But it does affect the upper thighs too. And when we have patients with lipedema, they have a lot of fat. And it's not just doing little spot areas on the outside of the thigh or the inside of the thigh. It's doing everything in a 360-degree manner to get rid of that lipedema fat. And because I do so much of it, I've become very specialized in doing these large areas of the thigh. So what I'm going to do today is I'm going to take some photographs like I have here in front of me, and I'm going to be doing some drawings and showing you what we can accomplish doing a 360, and also I'm going to show you what it means to do a full inner thigh, which is very different from the traditional approach. So stay with us, and we're going to set up our camera and do some drawings. Okay, thank you. Okay, here we are. We're back again, and what we're going to do is I'm going to show you what the transformation is going to be on this this patient's thighs, and I'm going to do it in a number of different ways, and I'm going to do it in a progression too, so that you can see from small amount to large amount to completely all the way around what the transformation is going to be. First of all, I'm just going to show you what traditional thigh lipo would be. So talking about thigh lipo from your typical doctor, it's going to be this little area right here, which takes away this bulge. It has to blend out. I'll just do it on both thighs here and show you what that can be. When we take away this inner thigh fat, we would see a change something like this. Just a little blip, okay? So you can see that doesn't really transform the leg in a overall fashion. When doctors do this, they don't take 100% of the fat right here. If they took 100% of the fat right there, it would leave a cutout that would not blend in with this lower part of the thigh. So what I'm going to show you right now is what it will look like to do a full inner thigh. And I'm going to show you the inner thighs first, then I'm going to show you the outer thighs, which will make this leg a complete 360. But to do the inner thigh, full inner thigh, we're going to see a bigger change that comes down, and the inner thigh, when we do it fully, actually extends all the way past the knee. And we'll see on this side right here that transformation is. So this is what I call the transformation of a full inner thigh, including the knee, and that would be this area. I'm going to outline it just to show you what that area includes. So if you can see the hatched area right here, that would be the front of it, and it would extend all the way to the back side of the leg, kind of along the midline of the back of the leg in the same fashion. So now this is what I would say makes a much bigger difference in the appearance of the thighs. And if you look right here, you can see how that not only takes away the inner thigh bulge, but it also slenderizes the knee. So that's not quite the 360, that's what we call the 180. So let's go ahead and take a look. Let me move that back out of the way. And we're going to take away what would be the outside of the thigh. Things actually cut in right here in a very beneficial manner. If you take a look right here, this is an area that very few doctors treat. We treat this all the time in slenderizing the knee. We actually treat this whole knee area in a 360-degree fashion, which very, very few doctors do. But anyways, this inner contour is going to make a big difference when that you'll see when I color it in here. As you can see here, it already this leg right here makes a big difference over that one, even though makes a big difference. So here we get to see the whole thing. And let me bring back the original photograph. There we go. You see how a 360 lipo of the full thigh will completely transform the leg. What you don't get to see right now is this frontal area. This frontal area, and I'll show you right here. This zone right here that I'm hashing in is what we call the frontal thigh. So although you can't see it in a 360, that part would be treated also. From a side view or a diagonal view of the person's body, you would be able to appreciate how that is making a difference also. All right, that being said, those are the different ways that we can transform the upper thigh. This patient's a perfect example because as you can see, her calves and ankles and the area down there, lower leg is already nicely shaped and hardly has any fat. I'm going to show you this patient from the back side now, okay? So here's her backside, and instead of doing it piece by piece, I'm going to go ahead and just draw in the full treatment here. So as you can see, the one side is much more slim than the other. I'm going to go ahead and do the other side now. Okay, so here we are with the backside, and let's bring back the original here. So you can see it's lined up, and one of the things that I would say that I've noticed and other patients have noticed is that the bottom is something that benefits in addition to the thigh areas. You can see right here that the bottom looks more toned. Right here with this outer flare of the thigh, both in and outer, it looks like everything's drooping down and that everything's a little bit saggy. And in this case, this patient's skin is very tight. It's not saggy, and you can see this kind of appearance even in 20 and 30-year-olds when their inner and outer thighs get on the fuller side. So if you take a look right here, everything gets a little bit of a lift. One of the things too, I'm just going to accentuate this a little bit. These little corner creases actually will start pulling up when we treat this area too. So I call that the butt smile. And the butt looks a little bit happier when it looks rounded up in these areas. So this is a Lipo 360 of the thighs, and something that you're not going to find unless you're just not going to find it in any practice unless you really search hard, and maybe if you're lucky you'll find another doctor that can do something like this. But it's just a rare thing for someone to be able to treat all these areas to this kind of completeness. As I mentioned earlier, if you don't want the full 360, we can still do the traditional areas that include smaller amounts. Some people just want a outer thigh, and the outer thigh without doing a Lipo 360 of the entire leg would look something like this. So I can do things that are changing, the legs in the traditional fashion. This is what would be a traditional outer thigh. versus a complete 360. So you get to choose, and we welcome you to send us your photos and let us show you what we can do. We're going to show you some of the before and after results of our previous patients here. So if you just hang on here, you'll get to see some real life before and afters. Thank you. So, you like it?
Yeah, it looks awesome.
Okay.
They're not touching anymore.
They're not touching anymore. There's me. Then look over so you can see your bottom.
Oh my God. Are you kidding me?
Does that look good?
I know you can't see my smile, but
Yeah. Yeah.
oh my gosh,
So,
really?
yeah. Let me fix this right here.